Acne in your 30s, it needs to stop. Adult acne, let's talk about it. Acne which starts after the age of 25 is called adult acne, and it can be part of acne when you had in your teens continuing beyond 25, or you can get acne for the very first time after 20s. Both of these would be part of adult acne, and adult acne is hormonal. Adult acne can look like any other acne, but there are very few things which are very characteristic to it. One is the distribution. Adult acne tends to be more along the lower half of the face, which is called an inverted U or a V pattern. These acne tend to be more painful, they tend to be bigger, and they may not be associated with whiteheads, blackheads that we see during teenage acne. Also, they may be associated with other hormonal disturbances like excessive facial hair, oily scalp, and greasy face. Let's talk about adult acne. Why does it happen? The single most important trigger for adult acne is hormonal imbalance. There may be many triggers for hormonal imbalance. Stress, gut issues, poor nutrition, and poor lifestyle are some of the important ones. Let's talk about these a little bit more in detail. There was an interesting study which showed that adult acne is more common in women who are working rather than those who are homemakers. There can be many reasons for hormonal disbalance in working women: the stress of work, poor eating habits, juggling multiple things at the same time. Not that homemakers have it easy, but there's definitely more on the plate for women who are working along with taking care at home. This brings us to an important point about nutrition in acne. Scientifically, two things which are known to trigger acne is dairy and sugars. So high glycemic foods and milk proteins are definitely that can make your acne worse. Keep that in mind when you're looking to improve your overall health and diet for your skin and hair. So how do you treat adult acne? More often than not, you would require the help of your dermatologist to improve upon those hormonal imbalances, whether it is PCOD or some other hormonal problem. But is there something that you can do to improve your outcome and your journey for your adult acne? Absolutely. Improving your lifestyle, including improving your diet, having a timetable that you stick to in terms of sleeping on time, getting up on time, having your meals on time, and very importantly, taking time out to de-stress yourself. Whether it is through meditation, whether it is doing something that you enjoy, playing a sport, doing some physical activity, something to keep you happy. Medical treatments would include taking some oral medications and definitely following a skin routine, including some topical medications and some basic cleanser moisturizers. Discuss with your dermatologist to find a routine that suits you, which is simple to do and effective at the same time. What about skin routine? What can you do before you visit your derm? My advice would be keep it simple. Skin tends to be easily irritated. Adult acne skin tends to be a little more greasy, more sensitive. Using something which is mild, less active ingredients till you visit your dermatologist who will guide you to the right ingredients. People assume that using AHAs and BHAs, something like glycolic acid, salicylic acid, would help your acne, but it may be actually doing you more harm than good, because not everything will work together. Some things work best for your specific skin, which would be determined by your dermatologist. So keep it simple till you visit your dermatologist and discuss other routines. You can do your part by eating right, staying healthy, and de-stressing.